If the White House succeeds, millions across the country will be affected, including 2.2 million Medicare beneficiaries right here in Illinois. Max Richtman is the president and CEO of the National Committee to Preserve and Social Security and Medicare. He's joining us tonight via Skype from Washington, D.C. to talk about the latest. Max, nice to see you again.
Thanks for inviting me.
Well, you know, the president said the Republicans will be known as the party of health care, so why are you worried?
Well, you know, just because the president says that doesn't mean it's true or that it's going to happen. I think we're going to see so many people denied health care, lose their coverage, be susceptible to pre-existing condition exclusions. It's going to be hard to square his hope that this is what the Republican Party will be known for with the reality. And I think that's going to happen fairly soon. If this court case is successful, the president has now once again attacked the Affordable Care Act. And when he does that, he's attacking the health care of millions and millions of people across the country.
Max, so I mentioned in the lead up to you, 2.2 million Medicare beneficiaries just in our state alone, 52 million benefit from the pre-existing conditions coverage. I can go on and on with these statistics, but I have several questions. Number one, already the courts have struck down the mandate, the payment mandate for people. Why didn't that kill it alone? Because wasn't that part of the critical funding for this act? But the act survived.
That did survive, and the reason we're looking now at another attack is because it did survive. For some reason, the president, you mentioned in the introduction that he's on a mission. I call it an obsession with killing the Affordable Care Act. It's not quite, he hasn't quite succeeded yet, but this is one more effort. Why in the world this has become his mission, especially in light of the fact that so many Republicans lost their races for Congress on this issue, on health care, on the need to protect and preserve the health care that the Affordable Care Act provided.
Is there another way? I mean, you hear Republicans say, we're going to preserve pre-existing condition coverage. Don't worry about that. Yes, kids on their parents' coverage till they're 26, no caps, all these things that people love about the Affordable Care Act. This is what they love. Republicans say, don't worry, we're going to give that to you. I mean, you study this stuff every day, Max. Can you figure out any other way that this can be done the way the Affordable Care Act did it?
There is no plan out there. Once again, we're looking at, remember back a year ago, the debate was about repeal and then repeal and replace. There's no replace here. There's nothing to replace the Affordable Care Act. If this federal judge strikes down the law, the Affordable Care Act, and that survives the judicial process, there's nothing there to replace it. And I might mention, you commented that I'm the president of the Committee to Preserve Social Security and Medicare. The Affordable Care Act did so many good things for the Medicare program and for all of those beneficiaries that would disappear immediately. You know, during the last couple of political campaigns, there were a lot of attacks on the Affordable Care Act centered on Medicare, that the Affordable Care Act was stealing $800 billion from Medicare. That was so wrong. That was a big lie. What the Affordable Care Act did for Medicare is it saved about $800 billion from reimbursement rates to providers. They used that money, most of that money, to improve Medicare. For the first time ever now, under the Affordable Care Act, Medicare beneficiaries get an annual wellness visit. They have, at no out-of-pocket cost, a lot of screenings, preventative care screenings, diabetes, colonoscopy, mammograms, extension of the Medicare Trust Fund by 16 years. So all of that will disappear.
And people will soon understand that, or they'll experience it. I want to just, while I have a moment with you, I want to just ask you the other end of the spectrum. We have progressive Democrats who are basically saying what we need, of course, health care for all and those kind of things. Get rid of private health care insurance, let the government take it. Is that, in your view of the world, is that the direction the country should go?
You know, we haven't taken a position on Medicare for all, and I'll tell you why. Our members are almost all exclusively on the Medicare program. We want to be sure that any change in law that affects their health care is done in a positive way. And we haven't made that determination. There are a lot of approaches that I think are available. One is to bring down the age for participating in Medicare from 65 to 55. That's something that needs to be examined.
And Max, we'll have you back on and talk about some of these.
All of the impacts of these proposals.
I'll have you back on and talk about some of those fixes. They're important. I just want to get your perspective, but I thank you for your time tonight. Very much appreciate it.
Thank you very much.
Time flies. Max Richtman, the President and CEO of the National Committee to Preserve Social Security and Medicare. Thanks so much.